The topic of this presentation will be on chronic obstructive pulmonary disease, also known as COPD. Chronic obstructive pulmonary disease is a life-threatening lung disease. It is considered a progressive disease, meaning that the disease grows more severe over time. There is no cure. Chronic obstructive pulmonary disease refers to a problem with breathing air out from your lungs. Until recently, most people who had COPD were grouped together and considered to have one disease. We now know that several different diseases cause this difficulty in releasing air from the lungs. Asthmatic bronchitis, chronic bronchitis, and emphysema are all three of the major diseases that are grouped together as COPD. Thus, COPD is not just one specific disease, but a group of diseases which all cause difficulty breathing. Chronic obstructive pulmonary disease is a lung ailment that is characterized by a persistent blockage of airflow from the lungs. It is an underdiagnosed, life-threatening lung disease that interferes with normal breathing and is not fully reversible. To understand COPD, we must first look at what normal lung function is. The air that enters the body goes down the windpipe into tubes in the lungs called bronchial tubes. Within the lungs, the bronchial tubes branch into thousands of smaller, thinner tubes called bronchioles. These tubes end in bunches of small, round air sacs called alveoli. Small blood vessels run through the walls of the air sacs. When air reaches the air sacs, the oxygen in the air passes through the air sac walls into the blood in the capillaries. At the same time, carbon dioxide moves from the capillaries into the air sacs. This process is known as gas exchange. The airways and air sacs are elastic. When you breathe in, each air sac fills up with air like a small balloon. When you breathe out, the air sacs deflate and the air goes out. The human respiratory tract branches repeatedly from the largest airway, the trachea, to the smallest, called bronchioles. The system of airways ends in the clusters of tiny sacs called alveoli. Alveoli are covered with capillary networks and are the site of gas exchange. In COPD, less air flows in and out of the airways because of one or more of the following. The airways and air sacs lose their elastic quality. The walls between many of the air sacs are destroyed. The walls of the airway become thick and inflamed. The airway makes a more mucus than normal, which tends to clog them. Most causes of COPD occur as a result of long-term exposure to lung irritants that damage the lungs and the airways. The most common irritant that causes COPD is cigarette smoke. In rare cases, a genetic condition called alpha-1 antitrypsin deficiency may play a role in causing COPD. People who have the genetic condition called alpha-1 antitrypsin deficiency have low levels of alpha-1 antitrypsin, which is a protein made in the liver. Having a low level of the ATT protein can lead to lung damage and COPD. If one is exposed to smoke or other lung irritants, breathing in secondhand smoke, air pollution, and chemical fumes, or dust from the environment or workplace also can contribute to COPD. Examples of other lung irritants include secondhand smoke, air pollution, chemical fumes, and dust from the environment or workplace. Most people who have COPD are at least 40 years old when symptoms begin. Although uncommon, people younger than 40 can have COPD. For example, this may happen if a person has alpha-1 antitrypsin deficiency, a genetic condition. These symptoms often occur years before the flow of air into and out of the lungs becomes declined. However, not everyone who has these symptoms has COPD. Some of the symptoms of COPD are similar to the symptoms of other diseases and conditions. The sensation of wheezing and tightness in the chest also accompanies COPD. These symptoms are a result of the decrease in airflow in the lungs. COPD limits individuals' activities and makes simple tasks very difficult. COPD symptoms usually slowly worsen over time. COPD has no cure. Quitting smoking is the most important step an individual can take to treat COPD. Other treatments for COPD may include medicines, vaccines, pulmonary rehab, oxygen therapy, and surgery. The goals of COPD treatment include relieving symptoms, slowing the progress of the disease, improving exercise tolerance, preventing and treating complications, and improving overall health. Avoid smoke and fumes. Visit a doctor at least twice a year. Ask a doctor or nurse about getting a flu shot and a pneumonia vaccine. Breathing and physical exercise and eating a nutritious diet are all suggestions for managing symptoms of COPD. Complications of COPD include, but are not limited to, lung infections, pneumonia, collapsed lung, osteoporosis, and heart failure. The National Heart, Lung, and Blood Institute estimate that 12 million adults have COPD, and another 12 million are undiagnosed or developing COPD. It is estimated that over 210 million people worldwide have COPD.